Guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. So, I'm going to go ahead and get started with the countdown days. And if you've been following my channel, I have been counting down the days to the AHIMA 2019 conference that is being held in beautiful Chicago, Illinois this year, home of the American Health Information Management Association. Pre-conference starts on September 14th, which is a Saturday, and that is 18 days from today. And the official kickoff, when everybody gets in on that Sunday, September 15th, it is 19 days from today. So I'm very excited about it. I can't wait. So anyway, we are getting into the home stretch before I have to leave for a conference. So I'm very excited. So let's go ahead and get started with the questions. But first, I like to thank everybody who's been submitting questions. I really appreciate it because you guys are helping to shape this episode. So let's go ahead and get started. Number one, do coders code for physicians or do they code for nurse practitioners and physician assistants as well? Yes, you can code for nurse practitioners and physician assistants. In some instances, you can code for nurses. It just depends on the setting that they're in. Always consult with your facility about, who has what privileges and in what setting. So that way you can be aware. Okay, so hopefully that answers that one. Number two, how to prepare for a test that has inpatient coding when you have little to no experience with coding for inpatient. So, exams that have inpatient coding on them that are testing you for it, obviously my advice would be to get the exam prep book for whatever exam you're taking, and be sure to look over it. That's about the best I can tell you, because people that are sitting for these exams, a lot of times, as far as like outpatient too, they don't have experience. They're brand new to the field, so maybe they don't have exposure yet to the outside world. So being sure to look at like all the resources that you have available. The test prep books are your friend. That is where you're going to find a lot of good practice. Be sure to review anything that was confusing for you in your class and in your sections. Ask lots of questions. So that's about as best as I can tell you, because with inpatient, it's just a matter of knowing your guidelines too, knowing them as well, and knowing what is appropriate to pick up and knowing your coding conventions. I mean, these are the basic foundation. You have to have good foundational knowledge of coding inpatient and outpatient as well. So be sure to review those things. Okay. Number three, resume advice for new coders. Okay. So this is a really good question because a lot of times I think that we kind of sell ourselves short in the beginning about like, as far as putting into words our experience, even though we don't have real world experience a lot of times. What skills are you bringing to this job or this potential job that you want to get? You have to shine those up and make them shine. Do you have a degree of some kind? It doesn't even have to be related to medical coding. Just make sure that you put it on there and indicate how you having this degree is going to help that facility or that doctor's office. How are you going to make yourself extremely valuable as a new medical coder and bringing all of your skills and talents with you? If you've had time to be in an externship, if you had an externship, put that on there, okay? Because that's going to look really good as far as experience goes, that you did an externship at this place or whatever. Try to get letters of recommendation from people that you do externships with. That's also another thing. So this way you have some sort of, oh yes, she's a brand new coder, but he or she is really great. They're very diligent. Those are the things that employers are looking for. Yes, they are looking for experience, but it is possible to get a job with little to no experience. It takes time though, okay? And I want to stress that more than once. It takes time. If you've had a chance to look at some of my videos, you'll know that I did struggle in the beginning. I struggled really hard to find a job because they were slamming the door in my face and telling me that, oh, you don't have any experience, we can't hire you. And I just kept thinking to myself, like, why would I get into a field that nobody wants to hire me without experience? And that is like, why would you not hire people who don't have experience? Like, how are they supposed to get experience? You know, that was my whole thing, you know. But going to a temporary agency was what really helped me. So all of those assignments that I went on made for good filler for my resume. And all of the experience that I was gaining being a temporary coder helped, because they put me in all kinds of sections, you know. I didn't have a choice of where I was going. I didn't make that a where I was going to be like, oh, I only do this one, or I only have experience coding this. No, I literally said, okay, I'll take anything. I will go anywhere you ask me to go. Because all I wanted was to get a job. And then my whole goal was to get back home. So if you've like I said, if you've seen some of my other episodes, I literally had to move when I first started, because I was with a temporary agency, and they had me on an assignment for 3 months. And they said, you know, we were going to pick one person at the end of these 3 months. And, you know, they didn't pick me. But like I said, that's okay. It wasn't because my skills were lacking. They just made their choice. And that's fine, you know, because had they not made that choice, I would not be in my current position today. And I would not be around my providers who I affectionately call my boys, you know, or, you know, I mean, I wouldn't have met all the people that I have met now, you know, had they not picked me. So I did end up getting a better job that paid more than I was making for my original job. And that was another temporary assignment. And what I learned there, I was able to bring to my facility here. So I used everything and anything that I could. Every single clinic that I had ever touched, I made sure that I put that on there, you know, because I just wanted to make myself look as good as I possibly could. I knew that I had it in me because, you know, I had a really good support system, which was my mom. And you know, having her as my support system and being, you know, such a good force and good positivity was really helped me. And you know, I knew I have it in me to do whatever it is that I wanted to do. And my whole goal when I moved was to move back home. I wanted to be back home. I wanted to be around my family. I wanted to be around my mom mostly because my mom was sick at the time. And I just wanted to come back home, you know. And so with my position that I currently have now, I tried to get in, and it took 2 tries to get in, you know, but I eventually did get in. And because I put all of everything that I had ever touched, that was what got my first supervisor, that was what got her attention. And she was like, oh, you know, she's got experience with this and she's got experience with that. And she's like, literally, it's showing on her resume. She's not afraid of anything. And so when she did talk to me on the phone, which is something I hadn't mentioned before, she asked me, you know, how particular are you with coding certain clinics? And I'm like, I'm open for anything. And you have to be open for anything. That is something else that you have to be willing to try. Don't get hung up on, well, I'm only strong at this, you know, in this clinic or that clinic. You have to be willing to try anything and everything. And if they put you in a clinic that you don't know anything about, that's okay. Do your research. Look on different websites. If it is for the pulmonary clinic, look on the American Lung Association website. Find out what kind of procedures do they have. Read that section of the book. Same thing if they stuck you in orthopedics, you know. Any and every specialty that you can ever imagine is all on the internet. So be sure to just look up anything and everything. And the more you know, the more confident that you'll get, especially when you're coding. because you want to make sure that you show that employer, yes, I don't have a lot of experience, but I am excited and I'm willing to try and I'm hungry and I want to learn and I want to do this job. So this is the sort of thing that is going to capture their attention after a while. But you have to have a lot of tenacity and you have to have a lot of go get it, because they will slam the door in your face. They will tell you we're not hiring you because you don't have any experience. They will tell you that. I'm just being honest with you guys. So this is why I'm telling you, on your resume, anything and everything you've done, any volunteer work you've done as far as like any sort of internships anywhere, make sure you put that down. Anybody and everybody in the medical field that will vouch for you, get them on your resume. Make sure that you have them as far as like your references, okay? Get letters of recommendation from your teachers, from the principal of your school, from the dean, or whoever. Make sure that you try to reach out as much as you can, because it is all about selling yourself. They always talk about selling yourself when you start in medical coding. Even when I started in school, they were like, you have to learn how to sell yourself because you may have a hard time in the beginning. They didn't really say that it was going to be that they didn't want to hire us with no experience. They never really said that. So it wasn't until I got into the outside world that I found that out. So that was not a nice thing to find out, when I finished school. But it was just like, okay, this is a challenge. And I was listening to this one lady today, and I love listening to this lady because she's very motivational. And she says that whatever you consistently spend your time doing is whatever you're going to be successful at. And I'm paraphrasing what she said. And that's a really good way to look at things, because when you are like, I want to be a medical coder and I want to get in, and I know there's a lot of people that are telling me no, but I'm just going to keep at it. And like I said, and in my case, I literally had to pick up and move, but that may not be possible for everybody. Another viewer had wrote in asking, if like certain cities were better for medical coders. There's actually a video out, and it's sort of old, but I've seen it. I make it a point of not watching other coders' videos because I want all of my content to be clean. I don't want any outside influences in my content. So this is why I don't. But I look at the title, and one of them was like the top cities for medical coding. So I don't know if you guys want to check that out. But obviously, if you're in a bigger city, you have access to bigger hospitals. Bigger networks of hospitals. So sometimes they have like remote coders. Sometimes they send their stuff offshore, but again, as I've talked about previously, it's not always sustainable to send work offshore because they always have to end up bringing it back. Majority of the time they have to bring it back, or a lot of the time, okay? In my opinion, okay? They have to bring it back because when you have somebody that has I'll put it to you like this. So sometimes when you're reading and English is your first language, okay, sometimes it's hard to understand what you're reading, and I've had to look up words like, what does this word mean? And if you have somebody that has a language barrier, this may be a little bit harder for them to be able to make the difference of, okay? So that's why I say, don't get discouraged if you're hearing that. If you're hearing, oh, it's all going to go offshore, I don't think there's a good way to sustain that because, like I said before, if there's a language barrier, it's going to be harder for that person to understand what's going on in that record. You need to be able to have good comprehension, reading comprehension, and it would still have to be brought back and somebody would have to correct it. So I'm just saying, don't worry about that if that's what you're hearing, because I heard that when I first started as well. And I started over 10 years ago. Okay, and they're still saying it. So again, with artificial intelligence and everything else that is coming into play, again, you're still going to have that human element, somebody that understands the documentation and can read it and can decipher what's going on. This is why training your providers is extremely important. Making sure that you work with your clinical documentation improvement specialist is very important. If you don't have one in your facility, then it's going to be on you. Okay, if you don't have somebody in your facility that their primary position is to do that, then you've got to do it, because as medical coders, we know what it is that we're looking for. If a provider is missing measurements on a laceration repair, you got to go talk to them and let them know, hey, doc, I see that you're not documenting your measurements on your laceration repair. There's a difference, between a simple, straightforward repair and a complex repair. So, and an intermediate repair. These things have to be documented properly. So it's all about working with your physicians. And I know I went completely off the resume question, but I'm just saying, getting back into focus, it's very important that you communicate. And like I said, you've got to talk yourself up and make yourself shine. Okay. And when you take your pre-employment test, which you will have to do every time you apply for a job, because they need to see what your knowledge base is, just make sure that you do your best. And if you take a test and they said, okay, well, maybe you didn't do too well. Okay, well then try to figure out what went wrong and work on it. Even though you don't have a job yet, work on it. Continue to work on it, because eventually, if you keep pushing, you will be able to get that job that you want. Okay? But you have to believe in yourself, and you have to keep going even when you are told no. Okay? So that was that one. Number 4, how many records does a coder code in a day? So it is going to depend on where you are, what setting you're in, inpatient and outpatient, or both. And if you do same-day surgeries, all of these have different amounts that you have to do in a day. So it really depends on the facility that you're at. Hopefully, wherever you are, they give you time to ramp up, as far as if it is 10 an hour or 15 an hour. In some places I've seen it's 20 an hour. So it really just all depends on where you are and what you're doing. As far as how much time does it take to code a medical record or an encounter, if you're in the outpatient setting, and I'll talk about outpatient because that's primarily what I code anyway. So for outpatient, we code by encounter, and whatever happened with that patient that day is what we're looking at. It depends on the provider. It depends on the specialty. It depends on the documentation. There's a lot of things that go into it. So I have 21 providers that I am responsible for. And these 21 providers are across a few disciplines. Okay, I've got podiatry, orthopedics, neurology, rheumatology, pulmonology, and yeah, those 5. And then I also help out sometimes with pain. Okay, pain and physical medicine. Again, that's 7. That's 7 different disciplines. Okay, that I'm looking at on a daily basis. And some of my providers I can work through a lot quicker because they're very straightforward with their documentation. They've heeded my advice on as far as being clear with what they're doing. I encourage them not to give me anything ambiguous, because if they don't know what is going on with the patient, that's okay. But please do not do this. It could possibly be this, or maybe it's that. Because if they negate a diagnosis, and I have no diagnosis because we can't pick up anything that is possible, maybe, or suspected, likely, whatever. I need them to tell me what actually did they come in with, were they injured? Okay. If they come in and they're injured, you can't pick up pain because they're not coming in with pain. Even though that injury is causing pain, that's not the reason that they're coming in. The reason that they're coming in is because they were injured. Now, what body part was injured? Well, I don't know if it's a sprain or if it's a fracture. Okay, that's fine, but they're still injured, and they're not coming in with pain. Pain is an organic thing, like the body is coming up with this pain, Now, if they have that, then it could be something different, because then you're looking at like maybe a bone condition, or maybe something going on in the body, with an organ or something. That's completely different from an injury pain. Okay, so there's a difference there, and we've had this discussion and we've talked it out. I've showed them different coding conventions and clinics and everything, and they're like, oh, so now they get it. But again, these things are things that you will learn with time. So that's it. Like I said, it goes back to how good is their documentation, because as more straightforward their documentation and more complete their documentation, the quicker I can get through it. I can get through an encounter in like 2 minutes, like looking at their documentation, depending on if it's a straightforward visit. Like if it's a post-op visit, obviously they're saying everything's okay. You just look at it, make sure the date there, everything's signed, and everything's where it needs to be. That's like 2 minutes, 3 minutes, 4 minutes at the most. But then I've literally had records where, encounters where I'm looking at it and it's taken me a half an hour, because either there's a lot going on with the patient, or there's something missing from the documentation that I got to query the provider on, so that takes more time. There's a bunch of things that go into it. But it all goes back to averages too. So if you're not meeting your quota in a day, as long as you're not consistently doing that, you're trying to meet your quota. Because like our quota, it depends on, like I said, where you are in the setting. For some people it's 120, some people it's 90, because like for me being in specialty clinics, it's 90 a day. That's what I'm looking to do every single day. I meet or exceed it a lot of times, so most of the time I'm exceeding it. Sometimes I meet it, because it just depends on how quickly I can get through these encounters. And some days I can't even hit 90. Because I'm either working with a difficult provider, or I'm working with a difficult chart. And I've talked about difficult providers before, where they're forgetting things, or they're not signing something, or the date is wrong, or something else is going on with their documentation. So there's a lot of things that go into this. And when I have an issue with a provider, I have to let my supervisor know. I've got to talk to the provider and see what's going on, and I make sure that I document that as well. So if I'm not able to meet my quota in a day, I can document on my workload report, hey, I spent this much time with this provider, and they were asking this question and that question, and that I do to cover myself, because it's not always possible to hit your quota every day. There's just no way. There's going to be some days when you're looking at documentation, it's not clear, and you have to sit there and look at it. So again, it all depends, but that's, I hate to give such like ambiguous answers, like it depends, but hopefully my explanation of it makes sense. All right, so next question. Where to go? Oh, here we go. Where to go to take an online coder class, and how long does it take? So both major coding associations, the American Health Information Management Association and the American Academy of Professional Coders, both have online self-paced programs. I don't know how long they are, but they are self-paced, and they do tell you how much time you have. So if that's something that you're interested in, be sure to check out both of the websites. I will be including their addresses down in the description box below. So if you are interested in becoming a medical coder, you can start there first and look and see what kind of programs they have, and see how long it may take you. Or you can visit your local college and see if they have medical coding programs there as well. Okay? And there's always trade schools, but I'm going to caution you all those trade schools, okay? Because we've all heard horror stories about trade schools. Let's just be honest, ask lots of questions. Go to the Better Business Bureau. Make sure that they don't have any complaints out there. Don't get yourself in a bunch of debt if you're not really sure that you're interested in it, okay? So make sure that you're doing a lot a lot of research first, okay? If this is really what you want to do, make sure you do your research first, okay? And I have plenty of videos in my catalog about what it's like in the day in the life of a medical coder. I talk about my experiences. I've talked about story time and just some things that happen either randomly or, you know, just stuff that happens at work. So not all of my videos are happy either. I've got some videos where you can tell I'm getting irritated because I remembered something, or, you know, it's just a situation that happened. But it is honest. Everything that I talk about on my channel is very honest and organic, and this is what happens, and this is the not so glamorous side and the glamorous side of being a medical coder. I will say there are some glamorous parts, conference being one of them, but there's some not so glamorous and not so fun times with being a medical coder. And then there are days when you don't want to leave. You want to stay and you want to keep working and you want to talk to your people, and, you know, you want to just read more, you know, with whatever they're documenting. So, you know, again, I am one of the most biased people when it comes to medical coding because I love it so much. And you know what they say, that if you love what you do, you never work a day in your life. That's where I am. So that's just my opinion on that one. And that brings me to my last question is medical coding worth it? Yes. In my opinion, yes, it is. But I will tell you that it's not for everybody, unfortunately. Because some people get into it and they see the money. And I've always said, and I've cautioned against that so much because yes, it is good money. And please don't ask me how much coders make, because there are plenty of salary reports out there, because every section of the United States is completely different with how much they start their coders at. So please look at the salary reports for your area, so that way you can get a good idea of what medical coders make. But they do make really good money, and I've always cautioned against getting into it because you see the money. We work hard for this money. I mean, there are medical coders that go above and beyond, like me, that want to make sure that the provider gets everything that they're entitled to. And I also have to educate myself. I am educating myself on top of being, you know, on top of a 40-hour work week. I swear I spend 20 hours of my own time educating myself, reading journals and reading articles and just reading different books or looking at flashcards so that I can make sure that I understand everything that's going on in the body. I do that. I do that on my own time because I'm invested. And not only that, attending conference every year. Now, I pay for conference myself. They don't pay. My employer does not pay for it for me. I pay for it out of my own pocket because I'm committed. That's what I want to do. Okay? So again, it does pay very well, but there is a price for it. How much are you going to be devoted to it? How much are you going to spend time with it? But it will reward you. I'm just saying. And this is all my opinion. Okay? So I'm going to go ahead and wrap it up because this is getting really long. And so if you guys have any questions for next Q&A Tuesday, let me know. Shoot me an email, and I will include my email address down in the description box below, or comment below and let me know what your questions are. I will put them on a list and get that list going for next week. Okay? So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye!